Giving you my love, giving you my love, love. Tell me what you wanna do, I'll do anything.
Okay, so where do I begin? Welcome back first, and if you are new, I am Tamika, and I do ultrasound and family things here on my channel. So I teach you how to juggle working full-time, family life, and also my YouTube. As a woman, we are very busy. We wear different hats, and we could be all over the place sometimes, but it's important to take your time, enjoy this journey, and love every moment. So in today's video, I'm talking all things about RN versus ultrasound and what avenue you should take. Let's get into this video. Okay, so I've done a little bit of research, and just going through the years, I have things written down. So if you see me looking down, it's making sure that I give you guys the right pointers. But one of my subscribers asked me to do a video about this, and I don't mind. That's why I asked you guys to leave the comments below. I'll do the research and get back to you on that. It's pretty plain and simple for me to do this video because I've been in the medical field now for 22 years, and I know pretty much a lot of things. I'm not saying I'm an expert, but I've seen a lot. I've done a lot. So without further ado, let's get into this. RN degrees. So I think I will break this video down kind of like by points, like comparison, this, instead of doing one category and then this category. Registered nurses make about $67,000 a year average. Ultrasound technicians, technologists, sonographers, whatever you want to call us, registered nurses make an average a year $67,000. Ultrasound techs make an average of $52,000 a year across the board. That's not in one state, that's just an average like estimate for both fields. Being an RN takes 2 to 4 years to complete your degree. Now if you just want to be a nurse, then that's a 2-year program with a diploma. If you want to be a bachelor's and have your bachelor's in nursing, it takes 4 years. Most hospitals will take either one, but they really love the BSN, the bachelor's portion of the nursing degree. The RN's job title is to care for patients, monitor their patients' vitals, administer meds, also start IVs and stop IVs, deal with needles, injections. They consult with doctors for patients' care. They educate families on disease and also after hospital care. They schedule treatments for the patient. They change wounds and like dressings, like for people who's been like amputee, diabetic, people who had surgeries. They gotta flush the wound out. They deal with bodily fluids, blood, urine, stool. RNs have to clean up patients. They give them showers. They do things that if you're not comfortable with that, then this field is not for you. That field would not be for you. They update patients' charts. They administer medicine to the patient as well, either through oral or IV, through their IV. And it depends on where you're working at in the hospital, the demand on you. You may have 2 patients, you may have 5 patients, you may be over, they see a cluster of patients. They have to deal with patients who are, free and clear of communicable diseases, meaning like airborne diseases and things like that. or they deal with someone who's in isolation. Right now we're dealing with this pandemic, so nurses are heroes out there, and they deal with that on a day-to-day basis. They have to get all gowned up and go in there and help those patients as well. So they have a lot of umbrellas over their head in what they have to do. But this field, medical field in general, is not for the weak. It's someone who wants to really pour into others and give their all to other people, strangers, and that's huge. Anybody who could sacrifice their time and their dedication to help others is amazing, and the medical field is a wonderful field. The job description type thing, what I just did with RN for ultrasound techs, are we scan patients, we help with diagnosing patients, we utilize the machine, we look at patients' organs, we assess their organs to make sure that there's nothing going on, or if there is something going on, report it back to the doctor. We explain the procedure to our patients, and this is just like nursing. They explain what's going on to the patient. We explain what's going on with the patient as well. We take doctor's orders. We sterilize our room, so we do clean our room. We make sure that the next patient comes in, it's all sterile and clean, and this is even prior to the pandemic. And ultrasound techs don't necessarily deal with direct bodily fluid, if that makes sense. Now, if a woman comes in and she's on her period, this may be TMI, and she's bleeding, we still will perform a transvaginal ultrasound if that's why she's there. If the patient has just had surgery on their legs and there's a wound there, we will scan around that wound. We don't take any dressings off per se, but if it's in if it's in the view of where we need to scan, then we will work around it. We might have to take it off. We'll use a sterile cover on our probes. We adjust. Two procedures called paracentesis and a thoracentesis, where a radiologist, our doctor that we work directly with, will come in and it's just like they numb the stomach for a paracentesis, and they draw off fluid. If you've ever seen like somebody with ascites, fluid in their abdomen. So we do those procedures as ultrasound guided, and we stand there with the doctor and help and assist with him. And then there's also a procedure where the fluid is built up in their lungs, and they do a thoracentesis and they draw that fluid off. And sometimes it's sent out for diagnostic testing, or it's just thrown away, but it's for therapeutic purposes only. And so that's pretty much in a nutshell what ultrasound does and what RN does. Now, their hours. Our hours are, it varies depending on where you work. You only probably have to work an 8-hour shift. Some departments have gone up to 10 hours. Nursing typically works with a 12-hour shift or a 10-hour shift, and then you have 3 to 4 days off. It just depends. But 9 times out of 10, nursing does 10 to 12-hour shifts. Ultrasound does 8 to 10-hour shifts. And that just depends on where you work. But that's kind of like standard across the board. The 3 top characteristics of yourself that you need to perform as an RN, and there's many more, but these are just the top 3 that stuck out to me. 1, caring. You have to be caring. 2, have empathy. You have to have empathy. You have to put yourself in that other person's shoe so you could feel kind of like how they feel, but so you know, like, okay, I can't be rude. I can't come in with an attitude. I have to have, I have to take care of this patient, and I just don't want them to think that I don't care. So you have to have empathy. The third one is be a patient advocate. It's huge. I don't understand. Even when my mother was fighting for her life, there's so many nurses that came into that building, and it was just like, or into her room, there were some really sweet ones and there were some really nasty ones, and it does not require that. My mom had gotten My mom got mad so many times at nurses, like, no, I don't want you, because it's not about you. It's not about you, it's about that patient. And it's about what you could do for that patient. And if that patient is telling you that they're hungry or in pain or what have you, take in consideration. Be an advocate. Go talk to the doctor. It does not take you no more time to help and pour into that patient versus going on your lunch break, calling someone, or checking your phone. It's a simple, hey, I will definitely check with the doctor. I'll get you your medicine. There's so many nurses that just was like, you know, and I'm not downplaying nursing. What I'm saying is that if you don't have these characteristics, why are you in this job? Don't be in this job. Patients are depending on you. And the top three characteristics for an ultrasound tech, exactly the same. They're exactly the same. You have to be caring. That patient's there. They're depending on you to find out what's wrong with them. You have to be, you have to empathize with that patient as well. If you don't empathize with that patient, then you're not going to care. You're just going to throw them on the table, scan, and get on your merry-go way. That's not the attitude to have. You need to have empathy, because God forbid if the roles were reversed. If the patient needs help putting the pants on, put the pants on. I help my patients all the time, men and women. Help them put their jacket on, help them get off the table. And these are things that you just go above and beyond for your patients, because they need you. And the last one is be an advocate. The last one is to be an advocate for that patient. If that patient's telling you, hey, you know what, I have pain, I don't feel this way, you know, you didn't scan over here. Call the doctor. Talk to the radiologist. You know, the order doesn't seem correlating with what the patient's telling me. There's no harm in you doing that. Go above and beyond. I don't know how to express that no more, because if you don't go above and beyond for that patient, then they're gonna fall through the crack, and you don't want that. You don't want that on your watch, and I don't want it on mine. So I definitely go above and beyond for my patient. I don't care if I get in trouble. I want that patient to be taken care of to my full capability. That was it. I'm gonna get off my little soapbox. But RNs and ultrasound techs can travel, just like my last video, and I'll link it here, about traveling. It's typically the same thing as RNs. It's typically the same thing as ultrasound techs. RNs can travel as well. They could work in hospitals, they could work in clinics, they could work all over the board, different psychiatric hospitals. They could work a lot of places, convalescent homes, care facilities, SNFs. They could work a lot of places. It's very, you're able to move around. You do have to take the NCLEX, which is the national boards for RNs, just like ultrasounds have to take a national board. Once you get into the field, whichever one you may choose, do it 100%. Give your all. Invest in yourself. Make sure that you're choosing a field that you know you could pour into other people. It's not about yourself, it's about others and helping others. I really hope that this video helps you on the path to your career. And I have to say, either one has its rewards. I give you my personal opinion, I will not choose RN, because RN has a lot of demand over their head. They are held to very high standards, and if you could just slip on one of those standards, it could be very bad for you. And I'm saying, you know, your name could be talked about, you could be talked about, you could get fired, there's so many things that could happen. You could get written up, and that's just because you're not taking your job seriously. And I don't want to be an RN. At one point I did. I got accepted to the RN program at Sac State, but I chose a different route because I didn't want to deal with direct patient care like that. And not to say that I wouldn't have done the job excellent, absolutely I would have, but I just didn't want the demand of taking care of 5 patients constantly every day, 12 hours on my feet. I didn't want that over my head. Ultrasound is a so much better fit for me because I'm in my own area. I have my own room. My patients come and go as they please. They're able to walk in or in a wheelchair. It does not matter, but I'm able to assist with them and make sure that they go to the right. It's like I'm able to like see their journey, you know. And once they come to me, it's pretty much once they come to me, if they don't have any other imaging left to do, I won't see that patient again. But while they're in my care, I'm gonna do whatever it takes. And then once they leave, they leave. Like, but with RNs, it's like you are, you know, that patient may be there 4 or 5 days or a week or a month or, you know, what have you. It just depends, but you're seeing that patient every day and you're seeing the progress. I get so emotionally attached that if I had a patient pass on me, I couldn't even work. I would have to take a sabbatical because I would be so far, like I'm gone. It would be hard for me to process. And so you do get attached as an RN to your patients, and I just can't handle that because I really adore my patients, and I couldn't imagine any of them like passing away or me coming in to my job the next day hoping to take care of Betty Lou and finding out that she passed. I just cannot. So I really hope that you guys enjoy this video. If you have any more questions, please leave them below and I will definitely get back to each and every one of them. Again, thank you for watching and I will see you guys in the next one. Bye.